Good morning, my name is Alex Calderon and I'm going to talk about assessment of mineral residual disease in standard risk AML. Definition AML, acute myeloid leukemia, is a cancer that starts inside bone marrow, the soft tissue inside bones that helps from blood cells. The cancer grows from cells that would normally turn into white blood cells, myeloblasts.
Inside the hollow area of the bones is a spongy core called bone marrow. It is here that stem cells are produced. Stem cells are immature cells that can develop into components of blood. Red blood cells, which carry oxygen to the body, white blood cells, which fight infection, and platelets, which help blood to clot. Acute myeloid leukemia, AML, is a cancer of blood and bone marrow. In healthy patients, stem cells produce myoblasts, or blasts, that develop into mature types of white blood cells. In AML, these blasts do not develop into mature healthy cells, but rather develop into immature or abnormal cells. As the number of these abnormal cells increases in the blood and bone marrow, fewer healthy, functioning blood cells and platelets are produced. If the bone marrow is unable to produce enough healthy lymphocytes, the patient will be unable to fight infections. The cancer cells can travel in the bloodstream or metastasize to other organs in the body, where they can begin to form additional tumors. AML is the most common type of blood cancer in adults, and it can also affect children. Symptoms consist of fatigue, fever, bleeding, and bruising. Current therapy includes chemotherapy, radiation therapy, stem cell transplantation, and drug therapy. Clinical trials involving biologic therapy may be available. Your doctor is the best source of information regarding treatment for your condition. It is important to discuss with your doctor which therapy, if any, is most appropriate for you.
Application in medicine. The presence of mineral residual disease as determined by quantification of NPM1, a specific margin consisting of mutation in the gene encoding nucleophosphine. Mutate transcripts provide powerful prognostic information independent of other risk factors. This is another explication of the video.
Leukemia is cancer of the white blood cells. White blood cells help your body fight infection. Your blood cells form in your bone marrow. In leukemia, however, the bone marrow produces abnormal white blood cells. These cells crowd out the healthy blood cells, making it hard for blood to do its work. In acute myeloid leukemia, AML, there are too many of a specific type of white blood cell called a myeloblast. AML is the most common type of acute leukemia in adults. This type of cancer usually gets worse quickly if it is not treated. Possible risk factors include smoking, previous chemotherapy treatment, and exposure to radiation. Symptoms of AML include fever, shortness of breath, easy bruising or bleeding, bleeding under the skin, weakness or feeling tired, weight loss or loss of appetite, tests that examine the blood and bone marrow diagnose AML. Treatments include chemotherapy, other drugs, radiation therapy, stem cell transplants, and targeted therapy. Targeted therapy uses substances that attack cancer cells without harming normal cells. Once the leukemia is in remission, you need additional treatment to make sure that it does not come back.
Pros, cons. Mineral residual disease that is detected of NP1 M1 sorry, it's being a strong prognostic factor of relapse and poor survival.
Acute myeloid leukemia, or AML, is a cancer of the blood-forming cells, which originate in the bone marrow. AML is the most common kind of acute leukemia in adults, affecting about 13,000 people in the United States every year, with 9,000.
This is a similar video of the others. Issue of the network. This can be a great help to network and the world because this way of detecting the mutation of NPM1 help prevent and treat with 2 times patients with type of leukemia and to lower the mortality rate. This is an interview.
Is acute myeloid leukemia. ALL is acute lymphoblastic leukemia. They are both types of cancers of the white blood cells. AML, however, is a cancer of the myeloid blood cells, and ALL is a cancer of the lymphoid blood cells. The symptoms for either type of leukemia can be very similar. Some children present because their parents notice they look pale or they're very tired. Some children present because they're having a lot of bruising or other
the same symptoms of leukemia. And the conclusion is the presence of minimal residual disease as determined by quantification of NP1 mutated transcripts provide powerful prognostic information independent of the other risk factors. This is a conference.
Used for therapeutic decision making. Now, looking at MRD as a predictive factor, there's certainly several time points where this.
And you can see the video in YouTube.